Hello, my name is Brian Wilson from Catalyst Physical Therapy and Wellness. Today I'll be taking you through a routine that we like to give our patients that are suffering from lower back pain, and they often find themselves throughout the day sitting at a desk, unable to really stand up, sitting typing a lot, spending hours and hours just kind of paying tribute to the computer and finding themselves slowly slouching more in their thoracic spine and neck kind of protruding forward. And then they get into this crouched position here where all the forces begin to feel and reside in that lower back. And then when they try to stand back up, it's as though they're still seated in the chair and have a hard time kind of getting that full extension to the spine. Usually this is happening along the lines of chronic lower back pain, getting yourself into faulty postural positions that when your mother used to tell you to sit up straight, we're going to show you some exercises that really just allow your hips and your thoracic spine, that mid part of your back, to begin to move better. And when those two areas start to move better, the lower back really feels more of a releasing sensation as opposed to this compression and this pounding force that we have to face when we sit down. Because we're built to be more locomotive creatures. So we're built to be upright, we're built to be moving, walking, bending throughout our day. But this paying tribute to the computer and sitting at the desk for hours upon hours every day is never really a good thing for our back. So we have to think about ways that we can kind of reverse that process and just intermittently throw it into our day. So the exercises we're going to be doing really don't need to take more than a couple minutes, because I know you got to get back to those TPS reports and make sure you get those emails sent out on time. But you do need to take a little bit of time to give back to those areas of your body that often fall and get a little bit more pressure, and then reverse those postural abnormalities that begin to happen throughout your day so you can wake up and stand up and move about the day without feeling so much issues in your lower back. So I'm going to call upon my friend here, Paul. He's going to come up and be our desk job employee here. So we will talk about ergonomics at another time, but for this situation, he's got his desk, he's got his chair, and the first thing I'm going to ask Paul to do is just kind of find himself relaxed and let him fall into his natural position that he wants to be in when he's sitting at his desk. So he's going to let himself kind of fall forward. You guys probably catch yourselves doing this all throughout the day. And that's okay. It's not as though we have to sit there and stay real support. But you do want to think about maybe your proper chair, your seat height, your the arms on your chair, the desk height, how high your computer is. All those kinds of things come into play. And we have handouts that we give to our patients often that just kind of outline what those parameters are for what you want to do. But you can look online and you'll be able to find plenty of those, I'm sure. So from this, we're going to actually tell him to begin to start to wake up his shoulders throughout the day. So what he's going to do is he's going to work on his thoracic spine and his lats that we know actually attach down to the lower back. So the first stretch he's going to do is a lat stretch. So all he has to do is scoot his chair back, and he's going to keep his arm fixed on the table, his desk, and then he's going to really feel a pull down through here. The more he drops his neck down, the more he'll get that pull to come lower into those lats. And then from there, he can begin to shift his weight side to side, go a little bit more right to left. If you want to stay and just hold on with one arm, you're more than welcome to do that to really sink into that one side that feels especially tight. But he's just going to move into that side-to-side motion. And then we can actually just start to scoot his hips a little and actually move from the frontal plane, going side to side in that manner as well. Really getting that release to those lats. And what we know will happen there is he'll start to see a very nice decompression in his lumbar spine. After doing that, say 10 times or so, holding it for a couple seconds in each position, he's going to move into the next thing. And the next thing will be his pec stretch. So we're going to open up that chest. And he's going to try to not kind of reverse, or he's going to try to reverse that issue where he feels like he's pinched in here and rolling forward and rounded. And he's going to try to open up that chest and rotate his spine and hips away from the actual muscle he's stretching here. He can fix his arm on the corner of the desk. You can do this at different heights. If you want to stand up and do it at about a shoulder height or above your shoulder height, that's going to hit all the necessary muscle throughout that pec, all those little fibers. But for right now, he's just, for the sake of time, he's just going to go into this one area here. And then he can, again, kind of start to shift and go a little bit away from it, in side to side. Good. So more of a frontal plane drive, so you're just going to drive your hips left, right, that side to side motion. And then he just did that rotational where he really winds it up. And then in that point, he can also go a little bit more side to side if he wants. Just kind of feel what feels good for you. And again, you don't want to jut the shoulder forward, putting a lot of pressure on the capsule or the bone in there. Nothing sharp at all. You just want to feel a gradual stretch going all the way to that sternum. Then from there, while he's facing this direction here, he would do that on both sides, obviously. or maybe one side if you felt tighter on one area. But then he's going to go into what would be kind of a seated piriformis stretch or a figure 4, in which he's going to rest that ankle on his knee and just gently begin to let this knee fall down towards the ground. He's also taking a little bit of a forward bend here at the back to bring in that little extra stretch to that piriformis. So he's stretching his right hip right now at this time. If you're feeling a pinch on your left side, a thing you could kind of do is probably open up your left foot to allow that hip to rotate out a little bit more, and then you won't necessarily get a pinch in the front of your hip, and you should begin to feel the tissue on this right glute piriformis really load and get some stretch. Then from there, he can kind of rotate his shoulder to enhance the stretch a little bit more and even pull across to the opposite shoulder. Now he's actually stretching more into his glutes. And you can hold these stretches if they feel good, just hold them. You can kind of move in and out. Again, there's nothing says that you can't move and just get comfortable when you're in the stretch. The idea is just to not let any sensation of like sharp pain or pinching at all happen in the hip joint, and to really feel the pressure throughout your outside of your glutes, your piriformis muscle, or in that thoracic spine as he's wringing it out this way. So let's go back real quick to that piriformis stretch where he was just seated here. Perfect. And then I want to show him, even in that position, as he's pushing his leg down towards the ground, you can bring this left shoulder over across the left knee and even enhance even more tissue pressure there in that right hip. And then he can kind of shift his body over side to side and just begin to get that frontal plane tweak to it. But the idea is get into the stretch, really feel it in the right area, make sure you're not getting any abnormal pressures or pinches in your hips or your lower back, and really get those hips loose. And then from there, he's going to take his foot, rest it back on the floor, and then we'll widen out that stance, getting a nice open stride here. And then what he's going to do is a forward fold, where he's going to decompress the lumbar spine. You can clasp your elbows if you want. Let that chin try to fall forward and really kind of just round out that back. And at that point in time, you should feel a nice, good decompression pressure to that lower back and give it all that. You can then begin to sway your body side to side if you feel good with that. And again, kind of letting the arms hang and move like a rag doll. That's always a good way to begin to get into it. This can actually, if you fix your hands underneath your feet and then pull from that area, you'll be able to get a little bit more traction. And again, focus that force across that lumbar spine. Should be a gentle releasing. It should not feel like you're straining or causing any, sharper type pain. If you do have that or it shoots into your legs at any point during this stretch, that is not a good pain, and you need to be seeking out a specialist in that respect and making sure you get more of an individualized program for yourself. So that's something we can talk about at our clinic. But the next thing he'll do is he's going to sit up nice and tall, and he's going to wake up his thoracic spine a little bit more and reverse that forward fold. So the way he's going to do that is he's actually going to use his arms and his shoulders, and he just ask his shoulders for that motion. So we're going to start off with just a punch straight up to the ceiling, reach it nice and high as you can, good, and let those hips go with it. And then reach the other side. You'll kind of see the chair just slightly move as he reaches nice and high, going straight up in front of his body. And then he's going to keep doing that. What he's doing is promoting a little bit of extension and core exercise here. Then he's going to take that and he's going to stay within that same plane of motion, that sagittal plane. He's going to drive behind his back and get a little bit of a back bend as he does it. If this is too aggressive, you could simply put your hands across your back and just kind of back bend in that manner, supporting that lumbar spine as you do it, which is another way to continue to get that reversal of that roundedness that you feel. And then now we're going to go into the frontal plane with those punches. So I'll step out of the way a little bit. But he's going to go to his right arm side, and notice how he's sitting his hips the opposite direction and reach the other way. Good. And then he's going alternating sides. Good. Again, this exercise, 5 to 10 reps, doesn't need to take a long amount of time. You're waking up those shoulders, pulling on those lats, and decompressing that lumbar spine. Then he's going to take it and he's going to go overhead and really stretch out that sidewall. Good. So he's going his right side, his left side. Again, 5 to 10 reps. And then we'll go into our rotational motion here. And what we know is this is one of the most important motions for your thoracic spine, because what this guy does is it allows that extension and that side bending and all those things that are important for this forward and bending and coming back up from it to really unlock and get nice motion. Excellent. So now open up and do a backhand reach as well. All right. So we'll pretend you went through about 5 to 10 of those. And then now the last thing we're going to do is go through a couple more exercises that are really focused on that thoracic spine and mobilizing that area. And what you'll do on this one is you're going to actually take your body and you're going to reach this arm as far as you can across this way to where you begin to feel the pressure through that thoracic spine like kind of lock up. Once that happens, you bring this opposite side over and you're going to let the neck, everything fall, and you're just going to take that arm and come there, reaching overhead into a side bend, but that's only after he's locked all the way into that rotation. So this would be more of a left rotation for his spine, and then a right side bend. Good. Excellent. Then do the same thing with that other side. Fixes it into the left rotation and does a right rotation, and then does a left side bend. Excellent. Good. Again, 5 to 10 of these. You may feel like you want to do 20, 30 of them. Whatever feels good. Keep it up. It's going to be a nice thing for that lower back. And then the final direction is he's going to open up his shoulder as far as he can, rotating again to the left, this time bringing this opposite shoulder open, and then he's going to side bend again. The same direction now. So it's not only a left rotation, but also a left side bend. So he'll do a good 5 to 10 of those, and then we'll switch up to the other side, rotating, locking out that spine all the way to the right with rotation, and then using that side bend driver as a way to bring motion out to those lats and those muscles across the back. So big side wall opener to that left side. Excellent. All right, Paul. Thank you very much. So when he stands up, he should feel nice and loose. And again, kind of taking the pressure down from that lumbar spine, asking the hips and the shoulders to really allow for more motion so that you don't sit there and get this compression or the sensation of blood pooling or tightness just sitting in throughout your day. Now again, if there's anything sharp, if you feel any problems with any of these exercises at all, or you feel like one side is really a lot worse than the other, you might seek out a specialist just to kind of find out and identify those flexibility inadequacies, or even get a better understanding as to why that pressure is building up in that spine. And we'd be happy to take you through one of those with a physical therapist if you're around town here in San Diego.